Good morning, everyone. Good afternoon. We may start. My name is Armen Sedrakian. I'm economist in Sub-Regional Office for FAO covering GCC states and Yemen. I will have this chance to moderate the opening session. So we're having this webinar of today organized by the UN Resident Coordination Office and FAO Sub-Regional Regional Office. This webinar is actually of today is covering very priority issue of our times, and it aims to bring for a dialogue wide range of stakeholders from many sectors as having importance to sustainable food systems, health, and nutrition and food safety. I can say that we have now more than 65 participants from a wide range of stakeholders from public and private sector, academia, civil society, and others. With this introduction, allow me to invite Ms. Fatima Al-Mula, representing Her Excellency Maryam Al-Maheri, Minister of State for Food and Water Security, for her welcoming remark. Fatima is working in Food and Water Security Office in the UAE. Fatima, please.
Thank you, Arman. Thanks very much. So we're honored to be able to have this important discussion during what is a difficult time and critical time for the world's food systems and the health of the global population in light of the current COVID-19 pandemic. My name is Fatma Al-Mullah, and I am here from the UAE Food and Water Security Office. 75 years ago this month, the Food and Agriculture Organization was established against the backdrop of a brutal global war with the aim of eliminating hunger and improving nutrition and standards of living by increasing agricultural productivity. While conflict has never gone away, the global community has been successful in preventing wars on the scale seen in the first half of the 20th century, thanks in part to the mediating role of organizations such as the United Nations. However, famine and food insecurity has remained an issue for millions of people around the world to this day because of, among other factors, localized and regional hostilities, a growing global population with more mouths to be fed, and climate change that is adversely affecting agricultural practices. Now, as we approach the first quarter mark of the 21st century, we find ourselves facing a new threat in the form of global pandemic that is impacting global food supply chains and affecting productivity. Even before the start of the coronavirus outbreak, it was estimated that by 2050, the world's food systems would need to sustainably feed more than 9 billion people, with the rate of production meaning that this was already unachievable. It was clear that the UN's second Sustainable Development Goal of zero hunger would be difficult to achieve. The global COVID-19 pandemic has exacerbated what is already a precarious situation and created an even greater incentive for us to act. It has brought home to us that now, the FAO's 75th year, we need to commit by accelerating the total transformation of our food systems. And this needs to be addressed to address the multitude of threats that they face, with the emergent threat being zoonotic diseases. Ladies and gentlemen, zoonotic diseases are unwanted byproduct of food systems and are a growing concern. Diseases are emerging more frequently from animals, and about 60% of human infections are estimated to have an animal origin. What is needed now is a concerted drive towards finding solutions to this growing health and food security threat based on the One Health approach, with stakeholder collaboration the essential foundation of this. The emphasis is in line with the 73rd World Health Assembly resolution on the COVID-19 response. which requested an urgent strengthening of the tripartite collaboration between the FAO, the World Health Organization, and the World Organization for Animal Health. The resolution called on using the One Health approach to prevent the emergence of new zoonotic diseases from the current COVID pandemic and to propose interventions to tackle the future of outbreaks. This is something that we need to implement without delay. Ladies and gentlemen, we have a busy schedule ahead of us this afternoon, which will see us discussing, among other aspects, the One Health approach and how we can incorporate it throughout our food security landscape. And I look forward to having these discussions with you. Thank you.
Thank you very much, Fatima. Thank you very much. Allow me to invite Dr. Dena Asaf, UN Resident Coordinator in the UAE, for her welcoming and opening remarks. Dr. Dena, please.
Thank you very much, Armin, and thank you, Dino and FAO, for organizing this very important UN75 dialogue. Also, greetings to our colleagues across the UAE, including Ms. Fatima, who just gave us an excellent opening speech. I want to thank also FAO, WHO, and I understand we also have the World Organization for Animal Health, who will be having presentations today. And as part of the UN family's engagement here in the UAE, we have a series of dialogues celebrating the 75th anniversary of the UN. This dialogue actually also allows us to further celebrate FAO's 75th anniversary, which is coming this week, a few days before the overall celebration for the UN on the 24th of October. So it's a double celebration as well, and for us to emphasize the importance of the work of FAO in our health and well-being as a planet. Additionally, I just want to also bring to the attention to all listeners that as it is the 75th anniversary of the UN, we are having global conversations around the world that we seek to have for the future. Prior to COVID, we had the slogan, the world we want. After COVID's hit us, we realized beyond the world we want, we have also the slogan of building back better, recognizing that where we were, is not good enough, and we need to have a better engagement across the planet, as this COVID pandemic has demonstrated to all of us. So we all look to build back better. I take this opportunity to also indicate to all of you that the United Nations seeks your input. So in addition, through these various dialogues where we hope to hear from you as well, we have a survey, UN75.online, which only takes a minute, to hear from you on priorities for the UAE as well as the world. So I encourage you to seek that out. In our dialogue today, we will have a variety of discussions around the sustainability of food systems and the importance of ensuring our engagement across the various areas of health and well-being and food systems of the UAE. The FAO is very well known, of course, for its knowledge-sharing platforms and evidence-based decision-making to support policies and programs in this area, and has been working closely with the UAE around food, nutrition, security, and sustainable food systems. As just noted, we also have on the 16th of October, World Food Day, which, as I said, also marks the 75th anniversary of FAO. And so the World Food Day is an important time for us to come together to understand the importance of our food systems. The COVID pandemic emphasized the importance of our preparedness and the need to manage similar risks in the future. The presence of animals and humans and how we live together is a direct threat to public health, as we've learned from the COVID experience. And therefore, we need to see what is it that we can do in the countries that we work to ensure that such situations don't happen in the future. How do we mitigate these risks? Currently, it's seen that the impact of unsafe food costs for low and middle income countries comes to about $95 billion in low productivity and another $15 billion related to medical expenses. And experts have also informed us that 60% of human pathogens are of animal origin. And we see 5 new human diseases every year, 3 of them appearing to come from animal origin. Therefore, again, the importance of this discussion today and in relation to our current context with COVID. The FAO, as well as several other UN agencies, work on a One Health approach, meaning that they look at this as a holistic approach. And we'll be hearing more of that today and learning how it's important that we balance the issues of public health, food and nutrition security, as well as sustainable development. I thank you all for coming and hearing from us today. And we also look forward to your feedback and input as we all have this consultation to learn more about the importance of food security and health and how the COVID situation has brought these things to our attention even more. As a final reminder, please go and share with us your thoughts on UN75.online, and we look forward to a good dialogue today. Thank you very much.
Thank you very much, Dr. Denab. Thank you very much for your support. I welcome Dino Francescuti for his opening remarks. Dino Francescuti is Sub-Regional Coordinator of FAO for GCC states and Yemen. Dino.
Thank you, Armen. Thank you, Fatima. Thank you, Dina, for your opening remarks to set the stage. Ladies and gentlemen, distinguished guests, colleagues, I'm honored to welcome you on this dialogue, One Health, Food Safety and Sustainable Food Systems, to mark the United Nations 75th anniversary, as we have already mentioned. Dina has brought it to the stage. And as we already have mentioned, this is a big occasion for FAO as well. 16 October, the World Food Day, is as well a celebration of the creation of FAO, Food and Agriculture Organization of the United Nations. But this year, we should also remember in the future that well-deserved recognition has been given to our UN agency, the World Food Programme, for the winner of the Peace Nobel Prize for their exemplary effort in reaching out the poorest and the most vulnerable. So, congratulations to the World Food Programme. We should bring this up loudly and proudly. The United Nations is very pleased to have this dialogue in the United Arab Emirates, a remarkable country in the global arena due to its economic performance and drive for innovation. The UAE has been a member state of the United Nations since its founding in December 1971 and joined FAO in 1973. Our anniversary comes as the world faces the huge global challenge of COVID-19 pandemic. And this has exposed, as we have heard from Fatima and Dina, the fragility of our health and food systems. In fact, before the pandemic, the challenge was already great. About 820 million people cope each day with chronic food insecurity, and more than 135 million of them were trapped into extreme food insecurity, and thus highly vulnerable to the COVID-19 impacts. Until the world finds effective control measures, this pandemic will continue to be a threat to push millions more into hunger. When FAO was founded, the world was emerging from a terrible war. On 16 October 1945, member nations set out the organization vision: a world free of hunger and malnutrition, where food and agriculture contribute to improving the living standards of all, especially the poorest. So to achieve food security, improve nutrition, and promote sustainable agriculture, we need to highlight the importance of One Health approach, food safety, and sustainable food systems. Ladies and gentlemen, as we have heard already, key studies show that 60% of human pathogens are of animal origin. 3/4 of newly emerging animal diseases can be transmitted to human beings, and 80% of pathogens can be used in bioterrorism are of animal origin. Zoonotic diseases, or diseases that are transmitted between animals and human beings, represent a direct threat to public health, animal health, production, and productivity, as well as food trade and food systems in general. Identifying and adopting One Health approach is important to build healthy communities. We need to recognize the connection between human beings, animals, plants, and their shared environments, whether they are aquatic or inland, in a very integrated effort to reduce disease and pest threats, also to ensure safe food supply for all people. Food safety is key to human health and food security. Effective national food control systems ensuring safe food for all are critical to protect consumers' health and ensure fair practices in the food trade. Therefore, the interrelationships between food security and human health are multiple. FAO is currently collaborating with the UAE in the assessment and strategic analysis of the food control system. Likewise, effective collaboration among actors of food supply or value chains, from production to consumers, is crucial to ensure sustainable food supply, proper food safety control, and adoption of a One Health approach. While food system stakeholders have been making changes to improve the resilience and sustainability of food systems, the many independent and sometimes conflicting initiatives of governments, private sector, and civil society have constrained progress pathways towards more sustainable food systems. Together, we need to make sure that our food systems supply a variety of food effectively and efficiently to nourish a growing population in a healthy manner and manage natural resources in a sustainable manner to preserve the environment for future generations. Let us all gather our forces to support One Health approach, food safety control, and well-functioning food supply chains in these challenging times in an effort to achieve resilient, inclusive, and sustainable food systems. In fact, the world and the UN is preparing to conduct the Food Systems Summit in 2021. And we know, we are informed that the UAE is well engaged in this process, both at the level of the UN Secretariat and also at the level of FAO. Thank you all for listening, and I wish you all the best in this dialogue. I will look forward to the positive outcomes of this meeting, and thank you all.
Thank you very much, Dino. We may now move to next session, which will actually present 4 keynote presentations. We expected to have Professor Banu Chowdhury Dean Faculty of Food and Agriculture from the UAE University with us, but unfortunately, Professor Banu will not be able to connect today. And I kindly ask Dino Francescuti to invite the next keynote presenters to deliver their presentations.
Thank you, Armen. Indeed, we were looking forward to having Dr. Banu Chaudhry, the Dean of the College of Food and Agriculture. Despite the fact that he was traveling today, he wanted to be and supported us on this. Unfortunately, he's actually now in India. He was supposed to connect from them, but things haven't worked out as we have expected for him to support us. We thank him anyway, because he was really looking forward to contributing to our possible dialogue with you all, with the panelists. But yes, I'd like to be very succinct. So time is saved for presenters and panelists. So yes, we have the next section, we have 4 presentations on the various topics that we are interested on. The first one is a presentation on One Health approach in combating zoonotic diseases, enhancing food and nutrition security and sustainable livelihoods. This presentation will be given by Dr. Marcos Tibo. Marcos Tibo is the Senior Livestock Development Officer of this sub-regional office. He has earned his animal science degree with a specialty in genetics and breeding from the Swedish University of Agricultural Sciences in 2006, as well as his former veterinary degree and in Addis Ababa University. His research areas of animal health and production are widely published in peer-reviewed journals. He has over 25 years of research and development experience in the CGIAR system and in FAO. Dear Marcos, over to you for the presentation.
Thank you very much, Dino. I will share now my screen. Thank you very much for the opportunity, and thank you, Dino. I would like to try to be as brief as possible. Today, we are going to talk about One Health approach in combating zoonotic diseases, enhancing food and nutrition security, and sustainable livelihoods. I think we are all celebrating today the birth of FAO 75 years ago. And as we talk about history, we also talk the history of One Health and integrated thinking in medicine. This has been first started by the French dean of the School of Veterinary Medicine in Lyon in 1762, who wanted to include the human clinical training in the veterinary curriculum, and who was heavily criticized because she raised this issue. Later, Rudolph in 18th century, he coined the term called zoonosis, which states who stated that between animal and human medicine, there is no dividing line, nor should there be. The object is different, but the experience obtained constitute the basis of all medicine. In the 20th century, both medicines, the veterinary and the human medicine, became increasingly specialized, were separating themselves into multiple sub-disciplines. In 1960s, the one medicine, which has been named by Calvin Schwabe, has made its origin because of his work with pastoralists in Sudan. And this is how it emerged. FAO, OIE, and WHO has given a One Health approach as a collaborative, multidisciplinary, and multi-sectoral approach that can address urgent, ongoing, or potential health threats at the human-animal environment interface at subnational, national, global, and regional levels. Okay, then which infectious diseases are emerging and zoonotic? As you may have heard, at least 61% of all human pathogens and 75% of all emerging pathogens are zoonotic. And according to the estimates of the World Bank, and in 10 years, there has been a economic loss of $20 billion in direct economic loss, and in indirect losses, $200 billion. As you can imagine, the pandemic that we are facing now, COVID-19, is going to cost the world $8.8 trillion, which is still yet to be adjusted, as we are still in the middle of the pandemic. And as you can see, all these diseases that you can see are emerging and re-emerging diseases. Some of them are newly emerging, others re-emerging, and also some of them are deliberately emerging by the human intervention for used as a bioterrorism. What are the challenges then? The challenges for One Health for countries is that most countries do not have adequate mechanisms for administrative and technical collaboration. There is a lack of joint preparation and established mechanisms for collaboration. And there is lack of coordinated planning, information sharing, assessment, and control activities across relevant actors. As you can see from this picture, you can see that zoonotic infections can vary, and it can involve so many important elements: bacterial, fungal, viral diseases, infections, and also food safety concerns. And there are a lot of benefits of having this tackled under One Health because of the comparative medicine and translational medicine, in addition to other zoonotic infections being tackled under one umbrella. What are the benefits of an effectively implemented multi-sectoral One Health approach for zoonotic diseases? I think this can be summarized as follows. It provides more timely and effective information, and all sectors have all the information they need to make decisions, and the decisions could be based on accurate and shared assessments by various sectors, and each decision makers will have a role in terms of accountability and also ensuring that actions are taken by all sectors in a coordinated way, and also regulations, policies, and guidelines can be provided in a realistic and acceptable manner and implemented by all the sectors. And the sectors also do this by understanding their specific roles and responsibilities in collaboration. Therefore, I think the benefits are multiple. The resources that are related to technical, human, and financial capital can equitably used and also effectively used to ensure this One Health approach when a One Health approach is implemented. And the gaps that are identified can be also addressed, or can be filled together, because capacity can be spread over various sectors, but these capacities can be put together to address the issue. Even for advocacy purposes, coming together can make it more effective. The FAO programs, what are the FAO programs and activities? FAO has a long history of addressing zoonotic diseases. For example, in the last 15 years, we have been addressing highly pathogenic avian influenza, and this response has been very effective and has prevented so many potential threats to the world. And FAO has multidisciplinary One Health team coming together from various sectors in providing policies and guidance, addressing the drivers and work in preparation, in prevention, and also supporting the veterinary services so that they detect and respond zoonotic diseases early. Recently, the IAEA has made an initiative which FAO collaborates, and this initiative is called Zodiac. And this through this initiative, the institutions are striving to strengthen the capacity of member states in terms of surveillance, detection, and timely responding to outbreaks of zoonotic diseases, moving from COVID-19 through coordinated research and development activities. As you know, IAEA, FAO has a joint center with IAEA, and the laboratories are highly reputable laboratories in Vienna. FAO has so many countries, offices in so many countries, and there are 33 countries where the FAO Emergency Center for Transboundary Animal Diseases are based. And through its decentralized offices also, FAO reaches out to member countries. And using also various capacities in headquarters, FAO strengthens the capacity of animal health sectors at various levels to reduce the risks and impacts from endemic and emerging zoonotic diseases, which could have pandemic potential, and also addressing antimicrobial resistance and also other important issues. Under tripartite, when we say tripartite, FAO, OIE, and WHO, the three important partners, they came together and have entered into memorandum of understanding. Since then, they have been building or developing guidelines and addressing One Health issues. And this important product, which has been published last year, is taking a multi-sectoral One Health approach to specific technical activities. This document is available online, and we can share also the link in the chat. And I think under this tripartite, initiative, there are so many areas, 15 areas each with tripartite teams. There are 2-year rolling tripartite action plan, which are also updated annually. And every year, the 3 DGs, the DGs of FAO and OIE and WHO meet to update each other and also move forward. And the One Health actions are being addressed in terms of public and private actors, all working together. And FAO is also repositioning itself by creating FAO WHO Center on Zoonotic Diseases and Antimicrobial Resistance. This is just created this month, this year, and this is going to have so many partnership and elements to address these issues. FAO is also delivering various products in support of national services to prevent and respond to zoonotic emergencies. As you may know already, the emergency prevention system for animal health, IMPRESS Animal Health, outbreak tracking, this is a GLUES, a global early warning system, forecasting, the Rift Valley fever decision support tool that FAO has developed. Using various tools and products, FAO is helping countries to forecast early the diseases that may come and create problems to member countries. There are several initiatives in FAO. For example, the Rift Valley fever risk maps, as you can see in my left, it helps to predict when the suitability of the rainfall, vegetability, using all these maps, it will alert countries so that they take action in terms of multi-sectoral response, such as animal vaccination campaigns, enhanced One Health surveillance, outreach campaigns, and supporting also the international efforts. By doing all this, this has witnessed a reduced impact of the disease in terms of animal loss and also human cases. As you know, Rift Valley fever is a zoonotic disease in East Africa, which has also prevented huge livestock export to the Middle East. In response to COVID-19, FAO has urgently developed a guidance for exposure assessment and also surveillance. This document is also available online. And also FAO has developed guidelines to mitigate the impact of COVID-19 pandemic on livestock production and animal health. And also various recommendations were given in terms of what actions need to be taken under this pandemic. And currently, FAO has like 6 to 7 umbrella programs. Under this umbrella program, Preventing the Next Zoonotic Pandemic, with the title Strengthening and Extending the One Health Approach and National Capacities as a main activity of FAO, its entirety. And the focus of this program or umbrella program is 5. The first one is mainstreaming a One Health approach in environment and natural resource agencies, improving national capacity to apply a comprehensive One Health approach to prevent and manage spillovers, strengthening policy implementation, enhancing national and international preparedness and performance during the emergency response, and developing policies for spillover prevention and containment. This is an umbrella program which is huge globally. And I come to the GCC states. What activities FAO has been doing in GCC states? In the last few months and weeks, FAO has conducted several webinars during the COVID-19 pandemic. And this was with Bahrain, Kuwait, and UAE. And there was also regional technical meeting in relation to preparation for regional conference, which has already been done. And One Health was one of the most important elements. And also we had a meeting with GCC Secretariat. And in February, we had successfully launched a project in Bahrain, which relates to...
Marcos, summarize a bit to squeeze the time a bit, I would appreciate. Okay,
thank you. I have only few slides. Yeah, and also FAO has led, has co-contributed to JEE, as you know, Joint External Evaluation for International Health Regulations, and also so many activities at the sub-regional level, and also regional meetings. As you remember, MERS coronavirus is still around, and FAO has organized very important events on this. And there are several pipeline projects which might be interesting for you. And I think in the interest of time, I will not read them, but the most important one is adopting One Health approach to animal and plant pests and diseases and preventing future zoonotic pandemics at a regional level. And others are very much related to it. And I conclude with this slide. COVID-19 has shown us that we need to go beyond our usual partnership. And this should be interdisciplinary and also multi-sectoral. And we have to change our way of doing things. We need to strengthen our collaboration in animal-human ecosystem interface And this, we hope, should lead to operational and comprehensive One Health plan. Together, we build our future through One Health approach to prevent impending pandemics as we identify our challenges in early detection and rapid response to emerging infectious diseases. Thank you.
Thank you, Marcos. It was a very comprehensive presentation, and you can perceive that this topic will give us a full day of dialogue. But let's move on. Let's now invite our next presenter, whose name is Tahir Jazin. Tahir Jazin is the Plant Protection Officer of the FAO Regional Office for the Near East and North Africa. He holds a PhD in plant protection from the University of Bari, Italy. He has over 20 years of experience in research and development, and both in FAO and outside of FAO, with a wide experience in the Mediterranean realities. He will present to us, the topic is Innovative Sustainable Food Cold Management, which will give us a first entry to both the efficient value chain management, but also to food safety type of. With that, Tahir, the floor is yours.
Thank you, Dino. Thank you, colleague. Thank you, Dino, for inviting me to make this presentation, and thanks for the nice presentation from Marcos. I would like just to share directly my presentation with a very fast comment regarding the Marcos presentation, which I feel it's very useful to hear for all of us. And what we want to comment is the role of plant in the One Health. So One Health is also, as you mentioned, Marcos, what animals eat are plants, and generally what's out of our system, the bad quality human used grains or maize, so the bad quality goes to animals. And that's what may accumulate the toxins in the body of the animals, and then the human being eat the animals, and we have the chronic diseases. Also, these toxins make the animals more vulnerable for the viruses and diseases, which in the next step transmitted to the human being. So the ring will close between One Health for animal health, plant health, and human health. So today I will talk to you about one of the innovative, sustainable cold chain method. And we feel that this method necessary to talk about that, especially for this pandemic of COVID-19. This may present an important solution to solve a lot of problems during the food conservation and value chain in such pandemic and in future actions. Especially I want to concentrate today about today we're celebrating the 75th year of FAO, and also we're celebrating the World Food Day. And this is important to know that 1/3 of the world food production for human consumption is generally lost during the conservation and during the management. So we are talking about 1.3 billion tons of the food lost during the processing. So food losses waste are approximately estimated about $680 billion in industrial country, and it's something like $310 billion in developing countries. Those amount of losses for quantity are generally estimated to be similar in the quantity of million tons. And who is the most vulnerable or let's say affected by these numbers are fruits and vegetables and all perishable conserved food. How they distributed in the world? And the losses, as we can see, affecting the quality, and this quality comes from the discontinuity of the cold chain. If we look to this map, you can find the orange color is related to the food discarded by customer, and the blue color is the food discarded by during the process of production, post-harvest, and the processing. You may notice that in some countries, the blue color is much wider in the southern part of the globe, and the northern part of the globe we see that the orange color is much wider. So we can find big amount of losses happened by the discarded by the consumers themselves, and also a large amount also discarded during the processing of post-harvest and the distribution. In both cases, we conserve the food in a cold chain. We transport them in containers. Generally, we have two modality of transporting the food. In the refrigerated cooling container, we call them intermodal containers, and the dry, operationally simple container. The refrigerated container is expensive, and they need an engine inside and have to travel in a special condition. But what we could have in this option, could we able to have this dry, simple container which costs less and don't use energy, and having all the option at the refrigerated container to have a continuity of cold chain? What we be able to have both of them together, cooling capacity and flexibility and independency from the engine. This story starts since 20 years ago, and the thermal energy using was already present, but who invented that and used together is a new technology just to store and release the cold energy during inside the container. It's the simple example, like what we call it eotic system. It's a kind of ice box which we get to the seaside where we conserve our food. It's exactly the liquid which is frozen and melt during the conservation period and releasing the cold temperature. So passive refrigeration simply is just a mix of those two containers together, intermodal container and the thermal energy inside. What it means? It means that in the walls in the container we have those liquid is frozen, and during the transportation, without an engine, without any energy during the transportation, this cold temperature goes inside the container and cooling the products without losing the energy. The difference is we have homogeneous temperature inside the container, and we don't need a big amount of energy. We have a saving estimated normally more than 80% of energy, and the container can travel easily without any engine connected, and this permits us also to give many options. One of them is port-to-port transportation. One of them also getting directly the product and the food and directly from the producer to the final consumer without passing through many processing. That means using the passive refrigeration system make a dynamic cold chain system. We are able to reduce a 60% reduction of the steps during the cold chain system. So this is a simple reduction from harvest to the loading of the final user of the product. And we have here the many steps have been also canceled totally. Different modality could be used for this system, for storing rooms or railways, for sheep, or for tracks on wheels, or also for simple small transporters for milk or for distribution inside the small roads in the city. Several trials and demonstration and experiment have been carried all over the globe, starting from green beans, table grapes, avocado, figs. And I mentioned the fig because here we can see that the figs have been transported from Egypt to United Arab Emirates in Jebel Ali. And it was a perfect example where the figs have very low price from the producer and low quality based on the modality of conservation. But using passive refrigeration, farmer was able to send a high price product with high quality to the final destination in United Arab Emirates. And this is exactly the figs which was sent during the experiment. Other application could be done also for any salad, vegetables, green, chicory rockets, also for any type of meats for freezing also. One important option for One Health here is the using the farmer or vaccines conservation for military and emergency use, especially in remote area where we can't reach the animals or we need to conserve the vaccines in good temperature without the presence of a continuous resource of energy. The same modality could be used for fish conservation, and also the PRS, passive refrigeration system, could be used on the boats for conserving the fish and maintaining the quality of improving the quality for fast killing of the fish by the cold temperature. Fruit and vegetables, and we talk about that, the weight losses is also an important point where the normal or conventional refrigeration have a forced air cooling, which reduce the quality and reduce the weight of the vegetables. And here an example where the rucola have been conserved in different modality without PRS on the left and with PRS in the right. Another example we can see here on cherry. Cherry also one from this sensitive products to be used, and passive refrigeration can save this product for 14 days. We have sometimes duplicate the time of conservation, and this is make the food disponible for the consumer for longer time. And this is why conserving the food in those modality could have the food availability and reducing more than 50% of the losses. Going for the use of passive refrigeration for conserving meat, we can reach something like 45 days more than conventional conservation. Here is also another example for conserving beef and without diseases. Regarding diseases, also the conservation by passive refrigeration, sorry, I'm going ahead. The important point to know that the sanification of the container itself, or reducing any contamination of the food contaminants, the diseases or bacteria, this is also be reduced because those technology will be available by sanification all the container from inside by ozone conservation. So in summary, we have high quality products conserved with high humidity, which improve the final product. We have environmental impact reduced. There is no reduction of energy. We have also the quality of preservation. We have big reduction of transportation cost. For example, when we talk about one container, refrigerated container from Morocco to Scotland to Holland, we can talk about 2,000, 3,000 euro. But the dry container could travel to make the same track by 600 euro. So it's big saving. We have availability also to make market was not available before, going fast and going far, saving the products, especially for highly perishable products. We have also cost saving, energy saving, and reaching the distant market. So what we expect from this result and what the role in COVID-19 here. So we have the possibility to have passive refrigeration and fully sanitized cold chain, to reducing any contamination, not only for plant pathogen, also for foodborne disease or human transmitted disease. Sustainability for food logistic, and we have a possibility to establish to reduce more than 60% of the cold chain, and reduce also the capital used for this cold chain. We have actually about 50% of waste reduced, and we have also supporting the economy by using, encouraging the importers and exporters to have high quality product for longer time and extend the product in the market. We have also energy saving and sustainable management, and the possibility to use solar energy to have a green conservation. You know, this conservation of product and cooling have a big consumption of our energy. So what we can summarize and why we would like to invest in this sector is saving for the energy. We have 50% of reduction of weight losses during the conservation. We have 50% reduction during the temperature, 60% of reduction of cold chain length, and 50% reduction of the food waste. And finally, 100% increase of post-harvest products. So the shelf life conservation increased more than 100% sometimes. So this is also meet with SDGs contribution, and this technology meet was several SDGs like 1, 2, 3, 6, and 7, also the 8, 9, 11, 13, 15, and 17. We make a small brochure about this to summarize this technology, and we will be sent together with this presentation to you all to have more details about and summarize the information about this technology. Thank you all, and sorry to be late, Gino, over to you.
Thank you very much. Great, very interesting subject that you have brought about. Let me remind the participants to pose your questions either in the chat or in the question and answer section. That would facilitate us at the end. We plan to recover your questions at the end after the panel discussion as well, so we can address properly with the time that may be available for us. Now let me come to the third presentation we have for you. And this, the topic would be food safety and food control systems. This would be Catherine Bessie presenting for us. She is from the Food Safety and Quality Division of FAO. She's based in Rome, and she holds a master's degree in agronomics and agro-industries. She has more than 20 years of experience in FAO, providing support to governments on official food control, led the development of the Food Control System Assessment Tool, which, by the way, is being applied in the UAE. So, Catherine, over to you.
Thank you, Dino, and good morning or good afternoon to all. So I'll share my screen. Hopefully it works. Okay. Okay, can you confirm that you get the right screen, the big slide?
Yes.
Good. Okay. Finally, I succeeded. So I will talk to you about food control systems. Basically, what I would like to highlight in this presentation is the role of food control systems, so official actions that governments take to ensure food safety, the relationships with international trade, and global food security. So I have a crowded slide, but in fact, it's true that there are many topics that are interacting in both ways. So let's start with food safety on the left-hand side of the screen. The figures that I'm giving have been produced by the WHO on the FERC study in 2015, and they tell us that they tell us many things, interesting aspects, but maybe one figure is that almost 500,000 of people die annually from a foodborne illness. It's a lot, and it's completely silent. And the other aspect is maybe the economic side of it. And it's the cost to the low and medium-sized countries. And yes, there are a lot of billions that are lost in productivity, but also a lot of money which is being spent by households on medical expenses. And all that money doesn't really support growing food trade and food security. So the impact of food safety in international trade can be very easily understood by the fact that at international level, you have rules that have been set up for, checking the safety of the food which is being traded. I would like to mention the WTO agreements, the World Trade Organization agreements, the SPS, the Agreement on Sanitary and Phytosanitary measures, and the TBT, which is the Technical Barriers to Trade Agreement. And in short, what those agreements do, among many other rules, is that they set Codex Alimentarius standards as benchmarks for international trade. So it means that food can be traded internationally and gain market access only if a certain level of standards is achieved. Obviously, international trade for families can mean, input into their livelihoods by gaining market access. It is important, but it is also very important in terms of food imports, because a country can actually increase, let's say, the food supply for the domestic consumers by importing food. But obviously, in order to maintain consumers' health, you want to have those food imports be safe. And this is the link between food security and food safety from both sides, the economics and the health aspects. I won't spend much longer on that slide for reasons of time, but actually it's quite complex because it can also retro feedback. But the topic of today is the role of official food control systems in ensuring that safe trade can happen so that it supports food security, it increases market access and resources for livelihoods while consuming consumers' health. And this is actually the objective of the Codex Alimentarius, Principles and Guidelines for National Food Control Systems. Basically, they establish the dual objectives of official food control systems, which is protecting the health of consumers and ensuring fair practices in the food trade, which is basically ensure that fraud is as limited as possible. I was referring before to the importance of Codex Alimentarius guidelines with regard to the World Trade Organization. And so this is why now we consider those guidelines from Codex as key for all governments to structure and maintain the functioning of their official food control systems. The three characteristics I'd like to highlight from those food control systems is situational awareness, which means be able to reach out to any relevant information, evidence, information on risks for public health, document what's happening in terms of trade practices, etc., to take your decision based on solid and robust data. Proactivity, it means you are reacting as early as possible if you have any information on an emerging disease or an emerging threat. But also you try to prevent. So by taking all measures that could lead to diminishing any possible threat on your food supply. And the continuous improvement is regularly look at yourself, what you're doing in terms of as a system, so that you build over time based on information and improvement of international practices. What I would like also to say about food control systems, it's that it's not only official control measures, regulatory measures, controls, seizing, sampling, analyzing, imposing rules, etc. But it also the integration of non-regulatory approaches, which is any preventative and educational approach, which can actually help the food business operators that are contributing to the food chain to adjust to the measures that are being imposed on them, because it's absolutely useless to impose measures that the food business operators are completely unable to comply with, because that leads to a disruption of the supply chain, which obviously is very bad for your food security. So for the safe trade that we were mentioning to thrive, I would say one of those critical elements is trust. it works both inwards, which means your domestic population must have trust that your controls as an official control authority are justified, fair, and efficient, but also outwards, because it means that it allows you to export to third countries. So your food control system is actually trusted by your partners, be them internal or external. Some elements supporting that trust are transparency. You are able to say what you are doing and what you are doing, why you are doing it. Accountability, you are taking responsibility for the results that are reached and for the, let's say, shortcomings and measures of continuous improvement. And independence is also another element, this notion of an independent assessment of where your system lies. In order to support countries to assess their systems, FAO and WHO have worked together very hard over the last years to put together a methodology which is based on Codex Alimentarius texts that allows either self-assessment or, when needed, we also provide externally facilitated support services so that countries can run those assessments of their national food control systems. So, in a short overview of the way those assessment works, we look at the resources, we look at the interactions of the systems with the stakeholders, we look at the capacities for the system to improve, and obviously we do look at how the control functions. So we are not only considering the technical aspects, which are the resources of the system, the staff, the policy, the legal texts, the way you apply your controls, the monitoring programs you have in place, but also the interactive and evolving nature. So the interactions with stakeholders and the continuous improvement dimension, because actually this is also to take care of those notions of the integration of regulatory and non-regulatory approaches, as well as the very much needed continuous improvement functions. How do we do that? For each of those big areas, we've defined competencies that we consider key for those areas to function. So for example, for the controls, we look at the domestic controls, the import, the export, public health surveillance component, food safety emergency management, monitoring and surveillance. So we have defined those competencies. And we are then measuring how those competencies are actually implemented through criteria. So for each of those competencies, we've defined criteria that are outcome-based as far as possible, so that we keep full flexibility with how countries want to organize themselves. We are not prescriptive about the how, but we look at the results that are achieved. So we are looking at if each criterion is achieved, partially achieved, or fully achieved. We've also made a lot of effort to unpack those criteria to allow measurement of weaker countries that may be at the very beginning of the way and allowing to capture those efforts. And we are proposing an evidence-based assessment to measure progress. And that was probably and that what surprises countries much when they are undergoing those assessments is that each and every statement must be supported by data and information. At the end of the day, the purpose of that assessment tool is certainly not to compare countries. We keep the results confidential and they have to be discussed with the countries itself. But the point is not to come out with one rating. So the outcome of that assessment is, let's say, sort of a chart of where performance is really going well and where it could improve. But again, we are not prescriptive about the priorities. It's up to each country to define during the process then where he wants to put its effort for improving on the next step. So this was just a capture of a top result of one country where we've run the assessment, but obviously it's all the rationale that supports all those measurements that matters really much more than the figures. But the figures are actually useful to support measurement of the progress. So that's the only reason we've decided to give figures. It's because it gives us a baseline for the way forward. As a conclusion for that presentation, I would like to highlight the benefits of an assessment, both at national and possibly at regional level. First of all, those assessments, even when conducted with a facilitated modality by having FAO or WHO supporting the process, are highly participatory. So countries are fully involved in the assessment by collecting data, analyzing that data, submitting that data. We do review the data, we look at the quality of data, if the data allows us to reach conclusions, etc. But basically the whole process is a learning experience. It also drives a coordination. There is a need for coordination among competent authorities. All national food control systems have different ministries involved, and one common weak point in any country is that degree of coordination. And we've observed that the fact of running through the assessment obliges them to work together to realize what other authorities may be doing and acknowledge their role. The assessment doesn't just end up on the figures that I've shown before. We move on to proposing a strategic planning process where we define priorities and try to pave the way forward. There is a rationale for that because it's all laid out by the assessment analysis, but we also set up targets together, So there is a full ownership of the country on the way forward towards this element of continuous improvement, which is so critical for those systems. And there is also a strong element of transparency. I was saying that FAO and WHO obviously do not share the results of those assessments, but the country should share it with the national stakeholders, certainly. And if they want, they can also share it with their trading partners. But that's a decision of the country to make. And there is an accountability also on the progress because we've defined a baseline and we know where we are moving and what are the results achieved for, let's say, either government investments or in the case of developing countries, also the development partners. And I think that's also very important for all of us, UN agencies and others, to integrate our efforts when we do provide technical support to countries. At regional level, when different countries have implemented this assessment, I think there are also benefits that go beyond the national dimension. First of all, this assessment is very much based on codex guidance. So basically, it helps countries to implement codex standards, and that actually helps the entire regional trade because the basis becomes common for all countries. Another point is the terminology, and it's particularly important for the region. There was quite a high degree of, let's say, differing terminology relating to food control in Arab-speaking states. And with that tool and working with the different countries, we have actually tried to contribute in harmonizing that terminology base. Why am I insisting on that? It's because when you talk to your trading partners and you discuss what control measures you have in place or you would like to see in place, if you use the same terminology, the discussion goes much better. And that's also much more fluid. And that's very, very important for trade again. And in a nutshell, it means a common understanding. Different organizational modalities in each country may lead to common results through approaches that start to be streamlined. So this tool doesn't push for all doing the same things in the same manner, but all reaching the same results, which I think is eventually what we are looking for. As a conclusion, I would just remind ourselves that those national food control systems are a key instrument for governments to support food safety for their consumers. So looking at public health, but trading also safely and having all the benefits of food trade. And all this contributes to food security and a One Health approach globally. But this requires continuous improvements through well-targeted investments. And I would say that robust assessments of where we are today are a good first step on that journey. And I've not talked about the COVID-19 so far, and that was intentional because COVID-19 so far, there's not much evidence linking that as it's not a food safety issue, but we know it has completely disrupted our ways of working, all of us, including competent authorities dealing with food trade. Change the way staff can attend the controls, the protective measures they have to take for themselves as any of us. And those changes, very brutal and violent, have disrupted the way we work. So basically, knowing where our priorities are as a system is key for us to keep our effectiveness. We saw many changes, but being able to maintain the route towards what we have established as a priority is really key in those times. So with this, I'd like to hand over the floor and thank you for your attention.
Thank you, Catherine. It's a very broad and interesting subject with specific tools that FAO is offering to the countries. Let's now come to the next and final presentation before we go to the panel discussion. This presentation is regarding the role of the food value chain actors in food systems transformation. These will be presented by Siobhan Kelly, Agribusiness Officer of FAO, from FAO Food Systems and Food Safety Division. She's based in Rome. She has wide experience in agribusiness and value chain management, as we are already discussing. So Siobhan, you're invited to take the floor. Thank you.
Okay, thank you. Thank you so much, Dino. And yeah, thanks again for the invite to be able to share our work on this topic. And so I suppose from colleagues, we've heard about in-depth areas of work, and this presentation is going to be taking us back up to that bigger picture, and food systems, and just to provide us with the space to think through actually what is a food system and what it might mean in terms of moving forward on policy making for the United Emirates. So yeah, I'm going to speak a little bit about the frameworks and the complexity, FAO's work on the topic, the role of the private sector in food systems transformation, and then some key policy messages. So if we look at definitions, these are just some that have been plucked out, but as the food systems debate is becoming more prolific, we're seeing more and more definitions coming into the literature. So many of these definitions have actually been adapted from the high-level panel on food security and nutrition. The first one there, for instance, is from FAO and is very focused in terms of what it defines as a food system. And then moving down, we see other definitions are a bit more detailed, but really what they do have at the heart of them and of all of the definitions coming out is this kind of interlinkage between the economic, the social, and the environmental, and providing frameworks as well about how the complexity that's involved in thinking in a food systems way can be simplified as much as possible. So up there in the right hand corner, you also see the number of sustainable development goals that have been associated with food systems transformation, and they really are numerous there. And in a sense, food systems thinking and approaches and frameworks can also be seen as a path to enabling us to respond and achieve the sustainable development goals that have been set. So moving on, this is just a I suppose, a visual of a framework there developed by FAO, and again, it provides this idea of the overlap between the economic, the social, and the environmental, and then some of the aspects that need to be taken into consideration there. And yeah, at the heart of it is sustainable food systems, but thinking about green growth, at the same time thinking about inclusive growth and social progress. And then more recently, more complex approaches have evolved, because it really is a very, very complex topic. And I think what's important to say here when looking at these types of frameworks is that every country is starting with a food system that is unique to them and is on a different trajectory. And so the starting point is different, the entry point is different. And, if you think of a country like the Emirates, obviously reducing the import bill is going to be a major priority for the National Food Security Strategy. Also similar to other countries in the world, the issue of obesity and introducing policies in the area of nutrition and linking that up then to the food system, engaging with the private sector. And then also food accessibility, obviously for more vulnerable groups, migrant workers, and those with insecure residency statuses also have to be taken into consideration in policy making. Again, another important one, obviously, for the country is the water security strategy and the aspects related to that. So just to really say that, yeah, every country is different, and so we'll use these frameworks that are out there in different ways. Yeah, but they really, I suppose, act as a checklist, are useful in that sense, and help countries prioritize and identify what are really the critical success factors on one hand and the hazards on the other. So FAO's work in food systems transformation. So I suppose the work has really been obviously gaining ground, and it's taken shape over the past 5 years, even more probably. And high in the agenda is the Food Systems Summit, which will be spoken about more in detail in the panel discussion. But yeah, also linked to food systems has been, and Catherine has spoken about that very eloquently, but FAO has really elevated, I suppose, the importance of food safety within food systems thinking and FAO's food systems agenda, and when we engage with our partners, because it's really the baseline for having a sustainable food system is having a safe food system. So also is FAO's COVID response and recovery program. So there are 7 programs there, one of which is on sustainable, which is on food systems transformation, and that is a program whereby countries can come in and support the organization to be able to respond to members' needs on food systems transformation in the post-COVID recovery. And then food systems assessments. Increasingly, members are coming to FAO and asking for food systems assessments, really, I suppose, to get a stock taking on where they are and where they might, where they need to focus on in terms of food system strategies. Also, what has been very important has been the programs that the organizations has developed. And yeah, in the sense that as FAO works with its members countries and encourages and supports member countries to be thinking across sectors, thinking across disciplines, thinking in multifunctional objectives. So too has FAO, yeah, that's been an important change in trajectory, I think, in terms of how the organization has worked in the past. So there's a number of programs there on the right-hand side that where food systems, multifunctional, multidisciplines have been integrated into those. And for instance, we've heard about One Health. Yeah, I don't have time to go into all of those programs, however. So yeah, just maybe that's really about the big picture. So maybe to try to ground the food systems topic a little bit and look at the private sector role, and in particular enterprises, food enterprises role within the food systems debate. And yeah, the next couple of slides are really talking about some of the issues that these companies have faced, for instance, in COVID. And the COVID crisis has again really brought to the fore the importance of working in this cross-sectoral way in order to resolve the challenges that the food system faces. So, you know, I won't labor on the points here. We're all very well aware, you know, of what has happened and what is happening. And just to say that this has led to, in a sense, a new normal. Okay, the companies that have really been have taken a hit. I would say there are no companies within the agri-food sector in any country that has not felt the pressures from the COVID crisis. But in particular, it's been the restaurant and the catering services that have felt it the most. And yeah, it's within that particular section, you've seen a lot of, you know, furloughs and closures. And so that has obviously implications for employment policies, and not only for employment and unemployment, but also for employment conditions as well, and shown up some of the challenges that employment measures face in terms of protecting those that are more vulnerable, women, youth, and yeah, people without in working in the informal sector primarily. And then beside this, then as referred to earlier, you have the growing obesity, and again, this is something that the COVID crisis has thrown up again. There was this a study by Euromonitor, for instance, honed in on the increase in what they call snackification, this idea of eating on the go, but it really came to the fore during the COVID crisis, where there was a lot of a big increase in snacks from retail analysis. And really also what it showed was as countries have tried to focus on stimulus packages, the need there for those stimulus packages to be tailored to the different needs of the various companies operating in food value chains. They all, from production to inputs to processing to food transporters to food storages, really all play such an important role in food security, and therefore all need to be in the debate and to have their needs addressed if there is going to be efficiency and sustainability. And then also what the COVID crisis has also thrown up is a more focus on growing local food value chains and supporting local food value chains. The lockdowns and the difficulties created in international trade, or the fears as well, there were a lot of fears created that international trade would be disrupted. And then for a country that, like the Emirates, that imports 80 to 90%, obviously, then looking at what the local agri-food sector can address within that priority policy area. And then also it really has catalyzed, and catapulted the whole area of digitalization and e-commerce, and for those countries that were not able to pivot quickly to adapt to digitalization, they really have been left behind. So this is a framework developed, and it's still in progress, to support the analysis of food enterprises and look at them from a food systems lens, and to be able to take that information then and consolidate it to inform policy making that is much more integrated and coherent in terms of the needs of the agri-food sector within the food systems debate. So I don't have the time, unfortunately, to go into that. And just to end with some key policy messages. These are just some, obviously, they're not all of them. But to say that, the food industry engaging with the private sector and those companies that are at different segments of the food sector, by engaging with them, you can engage on different areas that are relative to food systems, and identifying the inputs there that need to be sought in order to design a sustainable food system. And also engaging with the private sector to influence shorter domestic value chains. And I know that there is an initiative that His Excellency has been promoting, encouraging retailers to put local production from the Emirates to the fore in supermarkets and in food retailers. And this is the idea of using the new food consumer. Millennials, they're digitally connected, they're health conscious, they buy not just on the basis of price, but also on the basis of values and their ethical concerns. And so using this new food consumer to drive a policy agenda is also a recommendation here. And as I said, tailoring the stimulus package to different types and sizes of companies, and also with a focus on innovations moving forward. This is the only way that these companies can really compete, particularly those smaller companies. And the idea as well of building back better. So fiscal policies that reward companies that do have a good track record in sustainability as well, and leveraging this for public goods and public policies on food systems. So that's it. Thanks very much for the time. And if you have any questions, I can respond to them if time permits. Thank you, Dino.
Thank you, Silvan. Thank you for your for sharing the vision, the food systems and food supply chain vision. We will like to have some questions at the end. But one way of starting addressing some of the possible questions around it is precisely on the panel discussion that we want to invite now. On this panel discussion, we would have the participation of Professor Keith Sumtin, who is the FAO Chief Veterinary Officer and acting head of the FAO Animal Production and Health Division. We would also have the participation of Dr. Jamie Morrison, who is the Director of the Food Systems and Food Safety Division. Let me gather the rest of the persons that are part of the panel. Yes, Dr. Philippe Berger, who is the regional advisor, WHO, regional advisor for the Eastern Mediterranean region for food safety, Center of Environmental Health Action, based in Amman, Jordan. Dr. Mohammed Ali Al-Husseini, sub-regional representative of the World Organization for Animal Health, or IE, which is based here in Abu Dhabi. And Her Excellency Dr. Maryam Arab Al-Suaidi, Executive Director of the Control Sector of the Abu Dhabi Agriculture and Food Safety Authority. Welcome to our panelists, and let me guide you addressing one question for each one of you, but you're welcome to harvest from the various presentations that we have had. Let me start with Dr. Keith Sumtion, and a specific question to you would be, what FAO and the tripartite, this coalition that has been explained by Dr. Thibault, can do to leverage country capacities to operationalize One Health approach to prevent future pandemics and tackle the existing ones? Over to you, Keith.
Well, thank you very much, and it's a pleasure to be here. Preventing future pandemics is obviously a international concern, and we must learn from the lessons from our success or our difficulties with the current one at the moment before we can say what exactly is it that we need to do at every level. But first and foremost, to One Health has been mentioned very well and consistently through the presentation so far. So really it is about the operational setting in which the considerations that are from the environmental agencies are taken together with the animal health and human health at the same time. And almost all of our issues in preventing pandemics or operationalizing One Health need to become part of our working practices. And that's difficult because in many places there isn't let's say, a single ministry that is responsible for budgeting and planning for One Health. They are still kept quite separate in many settings. So therefore it does require our technical colleagues, preferably all together, but at least led by one of the most concerned agencies, to ask the question, what is it that we can do better than we are doing at the moment if we're going to work together on issues? Practical issues, for example, are the control of rabies in dogs. If we're going to, together, the three organizations of FAO, OIE, and WHO have a united against rabies approach to remove that dog-mediated rabies by 2030. Now, that cannot be done by any one of those working alone. It requires those agencies and civil society to be working together on the different facets of that. Preventing pandemics, where does it start? Well, if we consider that many of those do start with a wildlife source or an environmental source, perhaps then transmitting through an intermediary host, we have to work together to understand those risks by working with the environment agencies. We cannot then, and then to investigate those to validate whether there really is a risk. That often requires permissions with environment agencies to take forward. So really there's so many things that we need to do, but perhaps the One Health platform approach that FAO has been supporting is a way to try to ensure and consider, is there a quality of process in the countries to really understand the range of risks and then to be able to take decisions. And FAO is been supporting countries, many different regions to establish those platforms, to look at their surveillance systems and so on. But it needs a will to work that has to come from the country itself.
Thank you, Keith. Thank you for this first insight. Let me now invite Dr. Jamie Morrison, and let me address one specific question to you. We have heard about the Food System Summit. More than one of our colleagues have referred to it. I myself have brought up the issue. So what does the Food System Summit 2021 aim to deliver, and what is the process that has been put in place to make this happen? Over to you, Jay.
Thank you, Dino, and hello to everybody. And I must apologize from the outset that I will have to leave as soon as I've given this presentation. But if anyone has any follow-up questions, do please feel free to get in touch. So just in these quick remarks, I'll give a bit of background to why the Food System Summit will be convened next September by the Secretary General. And also a few words on the process that's been put in place to make this happen. So firstly, I mean, the starting point really is the 2030 Agenda, which requires that all countries work to eliminate hunger and all forms of malnutrition, but at the same time do so whilst creating growth and employment opportunities, which are needed to eradicate poverty, to sustain biodiversity and natural resource services, and to address the growing pressures of climate change. And to that extent, food system transformation has been identified as one of the key entry points for accelerating progress towards SDGs. Because if we get this right, it can really help us to move towards, we counted at least 14 of the 17 SDGs. However, as we've heard a couple of times this morning, many contemporary food systems are not necessarily living up to this aspiration. Indeed, we saw with the FAO State of Food Insecurity published earlier this year that almost 690 million people went hungry in 2019. And this is likely to rise by at least 130 million by the end of the year because of COVID. So yeah, a dramatic increase. At the same time, we see an increasing proportion of the population suffering from obesity. And it's particularly concerning that all of this is happening at a time that over 3 billion people are unable to afford a safe and healthy diet. And at the same time, food systems, obviously, as we know, are exacting quite a significant toll on the natural resource environment, are becoming less resilient to shocks in many situations, including those resulting from plant and animal diseases. And they're not providing secure employment opportunities to the majority of food chain workers. And this is not to say that nothing has been happening. Obviously, food system stakeholders have been making changes to improve sustainability. Producers have been experimenting with alternative production technologies. We hear of regenerative agriculture, for example. The food industry is engaging in more sustainable sourcing. As consumers, we're starting to seek information about safe food for healthier diets and advocating for more environmentally friendly food products. And as governments, we're taking actions in terms of strengthening control systems and regulations. But it's the fact that these different initiatives tend to be independent of one another and don't really recognize the complex interactions and trade-offs that are intrinsic to food systems that has constrained us as societies from moving forward to a significant change in the way that food systems operate. So with that background, the Food System Summit to be convened by the United Nations Secretary General next September, and we heard yesterday that this will happen during the General Assembly next September, provides a potentially transformative moment that can help societies to move towards more sustainable food systems. And an intensive preparatory process has been put in place, which will run for the next 12 months. And this has two main components. Firstly, a set of 5 action tracks, which will work to develop game-changing solutions solutions which can be implemented at local, national, regional, global levels, but which integrate not only the delivery of multiple food system outcomes, so they're not just focusing on zero hunger or climate change, for example, but bringing those together in one integrated program, but which also develop mechanisms for fostering coordinated action across stakeholders, which we know doesn't tend to happen. Very quickly, the 5 action tracks are firstly to ensure access to safe and nutritious food for all. Secondly, to shift sustainable consumption patterns. So this action track will really work to try to shift consumer behavior and also to alleviate some of the constraints to consumer choices, particularly around affordability. A third one on boosting nature positive production at sufficient scale. This one would work along the value chain to reduce emissions, increase carbon capture, promote the regeneration, restoration and protection of critical ecosystems. A fourth action track on advancing equitable livelihoods, which, as I was saying before, tries to address some of these issues with insecure and poorly paid jobs within many components of the food value chain. And a fifth one, which is really receiving a lot of attention now, particularly with respect to COVID, is how we build resilience to vulnerability, shocks and stress into food systems. Not only to ensure continued functionality of food systems in those countries which are particularly subject to conflict or to climatic or pest and animal diseases, for example, but also at the global level to try to mitigate some of the impacts of health-related pandemics on food systems. So that's the action tracks. The other components will be a series of food system dialogues. And these dialogues will take place at 3 levels. Firstly, at global level, so within planned global events such as the COPs on biodiversity and on climate change, within events such as Nutrition for Growth, but also at the national level dialogues. I'll come back to those briefly, and also independent dialogues. So a methodology will be made available which anybody can pick up and run within their own community to get their ideas into this process. But it's the national level dialogues which are receiving the most attention, at least in terms of our support. The idea here is to have a series of 3 national level dialogues in every country globally between November and next March. This is highly ambitious, but we already have a number of countries stepping forward, saying that they want to do this and to work with us in taking this forward. The idea of these dialogues really is to elevate ideas into the action tracks, but also provide a basis for ground truthing what is coming out of the action tracks in terms of game-changing solutions. So just to end, what we hope is that together these components, which will also be underpinned by robust existing and new science and evidence, we also have an independent scientific group supporting this process, that together these will provide the opportunity for all food system stakeholders, from producers through to consumers, to engage with this process, which we hope and which really needs to happen actually if we're to achieve the SDGs, would initiate a much needed transformation in many contemporary food systems. So thank you, Dino, back to you.
Thank you, Jenny. I do apologize that we are, running a bit over our time, and I understand, Jenny, that we have to leave us. We will want to come back to some of your questions that may be of relevance to you. We will get to you eventually through email.
Thank you.
Now let me invite Dr. Philippe Berger to reflect together with us, and let me pose one specific question. Based on the joint external evaluation of the international health regulations, this was done in 2005, and subsequent monitoring information, how was the country's preparedness in the East Mediterranean region before the pandemic, and what should change to better prepare and early respond to similar events? What has been the impact of the pandemic on food production, safety, and sustainability systems? And what efforts have led to curtail, minimize the impacts? You know, if you can pick one of these questions, I mean, you would be a lot. You would be doing a lot.
Yeah.
So let me give you that stage. Over to you, please.
Thank you very much, Dino, and thank you to all speakers for this very interesting webinar. So I will start not giving a lot of details, but I think it's important to focus regarding preparedness in the region on one aspect which is really still missing, the weakest, let's say, component of the IHR components, is the lack of the collaboration and exchange of information among sectors at national level. So we know that it's not specific to the pandemic, it's related to all possible disease surveillance. We observe a lack of collaboration between food sector and clinical sector, in particular in countries, region, and also in GCC countries, in order to better analyze and to better manage the data to track the disease transmission. I think this is very important. It would be also important to implement at national level again an integrated surveillance system, including a unique data platform accessible for all the partners, for all the authorities in the country. So FAO and WHO are putting a lot of efforts to in training and simulation exercise to involve staff from disease control, lab staff, food inspectors, and animal health professionals to participate together in this kind of exercise. So we have done already some simulation and some exercise, and we are ready to do more. Also, FAO and WHO are developing a surveillance and information sharing operational toolkit. The acronym is CISOT, to support national governments to establish and to strengthen the coordinated surveillance and information sharing system. So if you want more information, I will not develop a lot now for this during this webinar. As you asked me another question about the impact of the pandemic on food production and the food sector, I think it depends how you see the question and how you see the glass, half empty or half full. Half full first, if you compare to other sectors, I think the food sectors suffer less than many other sectors, in particular who are thinking about travel and touristic activities. And also, we even observe some improvement of hygiene due to the pandemic in some sectors. However, we should not minimize the impact on the food sector, in particular because some of the producers and some of the distributors of the food are widely involved in the touristic activities, and those of them really suffered a lot of the crisis. So, in a nutshell, I think the impact is very heterogeneous depending on the subsector in the food sector. I hope I replied a little bit to your difficult questions.
You certainly did. I do realize that this could be a 30-minute conversation, so I do appreciate your insights to it. And let me now invite Dr. Mohammed Al-Husseini, sub-regional representative of the World Organization of Animal Health. And Doctor, let me give you one specific question so you can enlighten us. What the OIE, World Organization of Animal Health, and your newly established office is planning to do in support of the GCC member states to operationalize One Health approach. Over to you.
Thank you very much, Chair. And firstly, I would like to thank FAO regional office in Abu Dhabi for giving me this opportunity to share. As it well known, OIE is the international organization that's handling and controlling the animal disease issues. And due to the fact that more than 60% of the diseases that affecting the humans is coming from the animal origins. So the OIE actually in collaboration with its regional and sub-regional representatives or representations, actually offices worldwide, working hard and prioritizing all the activities that related to One Health initiatives and concepts. This is reflected actually by many activities and initiatives that is adopted by the OIE. And one of the main things is that the enhancing the member countries always to work on eradicating the disease and mainly the zoonotic disease. The OIE is really work hard with its member countries to build the capacity of these countries in terms of diagnosing and treating and eradicating the diseases and mainly including, let's say, the zoonotic disease. OIE also is working on developing several manuals, guidelines, disease-specific guidelines that can be used as a reference for many of the professionals in the field for diagnosing the diseases. Lovely, the OIE is developed what we call WAHS system or World System for Animal Information. And through that system, it's gathering most of the diseases that's circulating in the regions. One of the very important topics that is have a special consideration, attention of the OIE is the AMR or antimicrobial resistances. And you know, this thing is really bothering mainly the human part, but also in the animal fields. The OIE pay a lot of attention and work in collaborations with the OIE and with the FAO and WHO to work and build. Also, the OIE with its representations working hard on educating the communities, actually through sharing in many activities, educational activities, communities activities, and sharing the knowledge and many things. And one of these examples, we are preparing for the campaign, AMR campaigns, and there's a lot of leaflets and infographics. It has been prepared to be shared to the community. So our office in Abu Dhabi as sub-regional representative, the main role of this office, as like other representations, is to implement and ensure that the working and implementing of the activities of the OIE in the region. Over to you, Dina. Thank you.
Thank you, Dr. Al-Husseini. Thank you very much. Now, let me have as a final panelist one that is very, is giving the touch, the seal of the UAE. Her Excellency Dr. Maryam Al-Suaidi, as Executive Director of the Control Sector of the Abu Dhabi Agriculture and Food Safety Authority. Her Excellency, let me address one question to you, and it would be, would you please give us some highlights of ADAFSA's work in food control, as well as One Health approach, from the experience probably in the control of MERS COV and the ongoing COVID-19 pandemic? This is, and in your view, what else should be done to be prepared for, to be better prepared for future pandemics? Her Excellency, over to you.
First of all, I would like to thank you and to thank FAO for their kind invitation to participate in this event. Regarding the food safety or the food control system, since the establishment of ADAFSA, the food control system, or Abu Dhabi, we started building the food control system based on leading practices, and we were benchmarking with leading practices in developing the food safety and food control system. So we started since then establishing or developing the food law and food bylaws. Also, we developed the food safety policies, and we developed the food safety strategy, focusing on strengthening our food control system in the Emirate of Abu Dhabi. And also we developed food control system for the food inspection system for the imported food. So we developed the risk-based inspection system for imported food, and also we developed risk-based inspection system for the local market. Again, we developed the smart control system by using devices by the inspector to do their job in the field using the smart control system. And we developed the food import management information system to control the imported food. As you know, the Emirates of Abu Dhabi mainly depends on imported food, highly depends on highly imported food. Again, we did focus on the awareness part on the food safety for our food handlers. So since 2008, we developed the essential food safety training program. This is directed to food handlers. As you know, in the Emirates of Abu Dhabi, most of the food handlers, they are from different nationalities, and we had to develop training programs specialized for our food handlers to enhance and to promote the culture of the food safety among them. And also in Abu Dhabi, we did develop the HACCP system for food safety management system for the catering sector. In order to strengthen our control system, we developed also the rapid alert system for food and feed, similar to the system implemented in Europe and elsewhere. Collectively, all these systems and among also other initiatives were developed in order to strengthen our food control system. Again, yeah, we recently, 2 years ago, we developed self-inspection system. It's on phone applications, where the food business operator can use this application so they can do the inspection for their businesses, and the DEFCA's inspector, through video calls, they can access through the camera of the mobile. They can access that camera and they can go through, the inspection report that done by the food businesses. And regard the One Health approach, UAE and Abu Dhabi, we recognize well the importance of implementing the One Health approach. As it is an integrated system to address the health threats. So we are aware that the mitigation of the health threats at the animal health and plant environment interface cannot be achieved by one sector acting alone. So the integrated approach for preventing and mitigating the health threats can be effectively resolved through improved coordination among public health, the veterinary health, the environment health, and the food control sectors. So we as ADAFSA in Abu Dhabi, we work closely and effectively with the Department of Health to address the infectious diseases, the challenges of the emerging infectious diseases. So, for example, in MERS and even in COVID, we jointly worked together with the Department of Health in active and passive surveillance. And also we did collaborative research with them to better understand the risk factor in Abu Dhabi, and such research were published. We didn't forget also the awareness part. We did work closely with Department of Health to enhance public awareness. And currently, with Department of Health as well, we are working to do the national COVID-19 surveillance in food establishment and food contacts and the services, as well as animal in contact with the positive human cases. So to prepare ourselves for future pandemic, I do emphasize that it is very important for the multi-sectorial collaboration, and we need to learn, of course, from the current crisis in order to address and to improve any and to bridge any challenges and gaps in the future. Thank you.
Thank you so much, Your Excellency. It's interesting to see the huge effort being placed by ADAFSA on addressing the issues that we have at hand. I would then like to pick a few, I'm very sorry for, being over the time, I would like to have, an additional 5 minutes or so we can address some of the questions, which, by the way, I thank my colleagues, Taher, Siobhan, that you have been already addressing on the chat responses to one of the questions. Let me just pick 3 to close our discussion. One from Ayla Al-Marsuki, and she was asking, for countries in water stress, what priorities do you think should be considered for the food production chains? And I would invite briefly Taher and Siobhan to give a glimpse of what you have already responded to her, so we can share with the rest alive. Over to you.
I may start, or the colleague Silvio start?
You can start, Taher.
Thank you.
Sorry, excuse me. Can you just repeat the question again? Because I didn't see it in the box.
I believe you have already
replied.
Oh, yes, I'm sorry.
Okay.
The question was, for countries in water stress, what priorities do you think should be considered for food production chains? I see that you both addressed that question. Over to you, Taher.
Okay, thank you. Thank you for the question. It's really a very important question in this sense. So what we may address is the important point for country have stress. I'm also from the region, so I know exactly what the stresses mean for lacking of water. The big important point is the water efficacy. We know to all of us that the efficacy of water is still used badly in many ways, and a lot of resources still need to be involved. In the same time, when we make reducing the reduction of food losses itself, it's also a better efficacy of water use, because the production of the food, production of the meat, also it's important use of water in the region. So when we didn't save this water, didn't save for all this quantity of used water, that's natural resource, and impossible to be able to have extra water. So we need to save what we have first, better efficacy and better use. Over to you.
Thank you. Thank you, Tahir. Anything you want to add, Siobhan?
Yeah, well, in addition to my response in the in the chat, I think I think this is really where as well the beauty of food systems comes in, because referring back to my point in the presentation about this idea of the new food consumer, you know, tapping into the millennial drive for buying food that is environmentally considerate, and so informing these consumers about the choices that they're making and the implications that it has on the water efficacy, for instance, and providing more data in terms of, you know, what crops or what food produce responds to that issue. You know, the younger consumers coming up now, as I said, they're very digitally connected. They look for this information, and so then that implies issues related to traceability, to labeling, to technology that's needed for this traceability, to connect to that data information, to log it all onto the labels. Yeah, I think these issues are resolvable, but we can accelerate it if we do kind of sit around the table in a much more kind of cross-disciplinary fashion, and as well tackling it from the market back, tackling it from the consumer back, looking at how the consumer can help us resolve these issues. So I think that's my additional point on that. Thank you.
Thank you, Siobhan. Let me now two other questions. One for our colleague Marcos, and specifically, you know, as we can see that with the current COVID crisis, the social dimension is very important in the spreading of diseases. Would you mentioned that human-animal relation, but how does the One Health approach tackle this social challenge? Over to you, Marcos.
Yeah, thank you very much, Dino, and thanks, Lionel, for raising this important question. There are very important issues to be discussed here. The human-animal interaction or relation is very crucial. As you know, the wildlife human interaction is so intricate and very much, you know, strong, especially in certain countries. We need to focus on risk communication in addition to other important elements such as coordination among various sectors, mapping the country's context, and planning and preparedness, surveillance and information sharing, and investigation and reporting, and also joint risk assessment among various sectors on certain risks, and also providing early warning for people who are depending on wildlife, and also having special interaction with animals, not only wildlife, also with domestic animals as well. There are very important elements that we have to really look into, including anthropology, studies such as, you know, how people behave towards certain animals in certain regions, and so many questions to be answered. Probably at some point we may need to be forced to leave wildlife where they are. I mean, why are we really interfering this level? I think certain countries need to enforce laws and bylaws and the good practices that FAO is providing for handling foods of wildlife origin and also animals from wildlife. As you know, Dubai is a very important hub where so many wild animals transit through, and I think there has to be also coordination among countries on putting some kind of checks to really curtail this type of practices coming from various countries. Thank you, Dino.
Thank you, Marcos. Let me ask one last question before concluding, and then we will certainly be looking at the various questions that you colleagues have already shared. We do apologize for having gone over the time. That question is addressed to Catherine. It's a bit provocative. Yes, food control and food quality still need more support in this region, the Near East and MENA region. In your opinion, what is the first step to take? It's a bit provocative here. Over to you, Catherine.
Thanks, Dino, and colleagues for the provocation. Look, yes, up to a certain time, there is still a lot to do, and there was also a very low level of requests that were made by government in that area. So, there are other regions where the needs are big, but the levels of request are also very dynamic. I would say that up to maybe a year and a half ago, we did not get any requests, or very, very few requests for direct support in the region. And it's changing. We've had much more active participation in the Codex Alimentarius arena, which is a good sign of an increased interest. I think there were initiatives in the region, some initiatives, including our colleagues of UNIDO, for example, where there was a lot that was done. And I think this has contributed to increase awareness by governments. I can very well understand that there is a perception, which is quite common, that food safety is a luxury when you have solved more basic issues, getting enough food in your plate, or the issue of water scarcity and so on. And then when you have all that basics, then you may start worrying about food safety, which is probably not really the way we should address things, because food safety should be included in the way we produce food. If it comes after, we've missed the target. So I think increasing the awareness of government is definitely a super important step. Then the other thing is that we, and I talk here on behalf of the international community, when we are facing requests, we should also, make real efforts to work together to provide integrated support to countries, so that they don't have the impression that each partner drags them into a different direction. And I would say that this is also a strength of the assessment tool that we've proposed, which actually it puts back the initiative in the hands of the government, and it gives them an instrument to integrate government support, government programs, together with support that is proposed by the technical and financial partners. So it all integrates into a one picture, and it puts a time perspective. We cannot solve everything tomorrow. We need to go with a notion of priorities, step by step, progressively. So yeah, sensitization first, and then being able to make plans that are compatible with the reality we all face. We need to make priorities, and we are many to intervene in that field, both at the level of countries. We have many competent authorities and many partners, donors, technical agencies, be them international from the UN or bilateral, because trading partners also have an important role. You want to export to a certain country, then I'm coming to help you to meet my requests. So all that is difficult to integrate, but we are really working on that.
Thank you, Catherine. I understand Siobhan would like to add very quickly something from the business side perspective.
Yeah, so I'm not a food safety expert, but I think looking at food safety from the business angle, and building on what Catherine has said, I think a first step needs to be to sensitize companies, food companies, from the production all the way up to the retail on the importance of food safety, particularly for a country like UAE, because it's the import substitution strategy that they want to pursue is that domestic companies are going to be competing on the shelves with companies that have very strong food safety practices in place, because they've had to have them in order to export. So that's really important. And just to also highlight the role of the Food Marketing Board. So the Food Marketing Board generally, I'm not sure about its status now, but it's either semi-state or semi-state. I think semi-state is a good practice. You have the private, the public sector in there, and they really play that interlocutor between consumers, informing consumers, guiding consumers, and also engaging with the government at the same time on issues such as food safety and also water sensitive food production. Thank you.
Thank you. With that, I would like to conclude, giving you, a very general reading, very brief, and then I would like to invite Dina as well to say, any specific impression of her side. Clearly, we have a very complex action area. I mean, what I can say is that we have to base our actions on strong evidence. So science, strong science behind is a key to it, to deal with the things that we used to deal before COVID-19, but now with COVID-19 and similar things that may come in the future. So strong science behind, act in a multi-sectoral manner. It sounds really complicated. I mean, it's not easy, but precisely because of that, things like operation toolkits, specific work plans to understand how to go about it step by step. I mean, the fact of working multi-sectoral is a challenge, but precisely because of that, we have to be better in planning, in thinking ahead. And with that, clearly the capacity building that was referred to by Dr. Mohammed and Her Excellency would become easier to understand where we want to be building capacities on, build systems that have that vision, multi-sectoral vision, but clear step-by-step guide. I would like to say only that it has been a long journey, a lot of good knowledge. I trust you have benefited from it. I would like to invite Dina to give us her impressions, and with that we will conclude this UN75 webinar. Over to you, Dina.
Thank you very much, Dino, and I greatly appreciated the discussion today. I've learned actually a lot myself, as I'm not a specialist in this area, but I think the speakers in the lineup of panel discussions demonstrated the complexity of the food systems situation, especially here in the UAE, and the strong work that the UAE is doing, as well as areas for further improvement. I think we also want to conclude as a group, which was emphasized throughout the discussions today, that the COVID pandemic has brought to our attention the importance of the One Health approach that is advocated by FAO, as well as the weaknesses that are in our food systems. You also stressed the importance of innovation, and the UAE has demonstrated its strength in innovation. And I believe many of the recommendations that have been made by the panelists can be taken forward further by the UAE. So we look forward to this, and thank you very much for an excellent dialogue. And I hope our colleagues also can join us in future dialogues in the coming months. Thank you very much, Dino. Over to you.
Thank you, Dina. So with this, let me once again thank presenters and panelists for their sharing of knowledge and for sharing their time. This is important for all of us. Thank you very much for our colleagues from the UAE, Fatima Al-Mula, Her Excellency Maryam, for having been with us and make this the UAE and UN joint effort. So thank you very much, everyone, and have a good afternoon.
Thank you very much.
Thank you.
Bye.
Thank you.
Bye-bye.
Assalam.
Thank you. مع السلامة.
السلام عليكم جميعا.
Thank you. Bye.
Bye.